Angelina Jolie opening up about her health. Jolie tells Vanity Fair magazine in a long-form interview, I think the first after her divorce, that she developed Bell's palsy last year, and in fact that it caused one side of her face to droop. She says that she cured it with acupuncture. So let's talk about Bell's palsy. Maybe you've never heard of it before. Joining me now is Dr. Babak Azizzadeh. He's the director of the Facial Paralysis Institute. Doctor, I think this is an important thing to talk about. I know people in my own field that have been struck with this. Why don't you tell us, explain what Bell's palsy is?
Good morning. So Bell's palsy basically is a disorder that affects the nerve that moves the face. We call it the facial nerve. The facial nerve basically travels behind the ear from the brain, behind the ear, and comes out and starts going under the muscles and helps our muscles of expression move. And if there is an inflammation or swelling in the area just behind the ear, the nerve kind of stops working. Now, the nerve generally regenerates, and in 90% of patients, the nerve goes back to functioning normally. But in about 10% of patients, individuals can have long-term problems like paralysis and tightness and problems with their smile and eyes. So it is actually a very common process. It happens about 1 in every 400 individuals. But because most people return to normal function, they do quite well.
So do we know the cause? You talk about this swelling, but is stress a factor?
So we all have cold sores on our lips. Most individuals have a cold sore on their lip. It's a type of virus. This virus kind of never leaves our body, and it resides actually around that nerve behind the ear. So in stressful situations and in actually pregnancy, it's very common for this nerve to get reactivated, this virus to get activated, and that causes the swelling and inflammation around the nerve that can cause the nerve to stop working.
But how terribly frightening for people, because of course, whenever we think of any sort of paralysis, we automatically, our brains go to a stroke or something like that. So tell people about sort of the prognosis. You say that in 90% of cases, people's faces go back to normal. Are there other symptoms? Are there other warning signs? Are there other long-term effects?
Yeah, so there are really no warning signs for most people. The most important thing is immediately you need to see a healthcare practitioner, because studies have shown that if you're treated with steroids and antiviral medicines like Valtrex, you can have a much higher likelihood of returning to normal function. So that's the most important thing. And the doctors need to make sure that it is not a stroke and it is not some other tumor or growth. So it's very, very important that you go to an emergency room or your physician immediately. Regardless, about 5 to 10% of patients can potentially have some residual paralysis issues. And those patients are going to need other treatments such as surgery, or in fact, Botox is one of the treatments to help connect and reorient the smile muscles.
Okay. I have to wrap here, but quickly, acupuncture, would it work or no?
There have been no studies that have shown acupuncture works, but I actually do recommend acupuncture as long as the individuals don't get electrical stimulation, because a lot of times, if the nerves get reactivated over and over again, you could have some long-term issues. So acupuncture is fantastic, but no electrical stimulation.
Dr. Azizzadeh, thank you so much for informing us all about Bell's palsy.